So at first, I would like to say thank you for the committee, the steering committee for giving us the invitation to share the application of PLT to improve the patient safety in Hoàng Mỹ Cô Lâm Hospital. And I would like to introduce a little bit about myself. So my name is Ngoc. I work as a doctor in quality department, quality management department in Hoàng Mỹ Cô Lâm Hospital. Can you go to the next slide, please? So my presentation will have 3 parts. So at first, I will give a brief introduction about my hospital, and the second point is how we can sustain PLT in our hospital. And third point, I will share some improvement that have been conducted in our hospital. Yeah, can you go to the next slide, please? So I will give a brief introduction about our hospital. So our hospital was established from 2007, and we have nearly 800 staff with 400 beds. And annually, every year, we welcome 23,204 inpatient and 293,000 outpatients. So yeah, and then can you go to the next slide? Yeah. So I will give you a brief picture about the journey of our hospital joining to PLT program. So we first joined PLT program from 2019 with the health-wide workshop. And then next year, 2020, we apply PLT to improve the patient safety by applying many different kind of checklists. And we also produce a lot of textbook for staff to understand more about patient safety by using PLT. And with the 2021, with the year 2021, because of the COVID-19 pandemic, so we cannot conduct a lot of activity. However, we still join the PLT Mekong Delta workshop last year. And with this year, we also organized a PLT photo contest with motivate a lot of low-cost improvement of our staff. And we also joined the PLT Mekong Delta workshop this year. And then we also would like to share how we can maintain PLT in our hospital. So we are thankful to have a very strong support from our CEO, and also we have people here very committed and very interested in PLT. And we also very lucky that our staff always very willing to learn new approach, especially with PLT. And then we try to use PLT as a very great method to improve the patient safety, because in a hospital area, we believe that first we do no harm for the patient, so we prioritize the patient safety. So I used to share that in order to reduce the risk of the patient, we try to use a lot of simple procedures, and also we implement many practical improvements. And as Dr. Khai has shared in his presentation, we also apply PLT training for TOT and expanded for many different kinds of staff in our hospital. And the last one, we also organize, celebrate PLT photo contest, just like the way we did a photo voting in our hospital this year. And I will show for you some picture about our core team. This core team was established from 2019. And we also organized a achievement workshop for our staff to share their good practice with a lot of improvement. So this is a photo of our achievement workshop to share good practice. And we very motivate the staff by give them prizes. And we also apply PLT training for our staff, not only for the staff, not only for the healthcare staff, but we also train for the safe care, for the cleaning people. And we also using different kind of platform. For example, we organize mini game for staff on our workplace. So workplace in Hoàng Mỹ Cửu Long Hospital look like our internal Facebook. So in this platform, we can easily to approach, and we can play, we can have games and share experience in this platform. So we organize mini game for people to understand more about PLT. And this year, we also organize a photo contest for our staff to share their good photo practice and good improvement. And it is the number of our quality improvement projects from 2020 to 2022. So from 2020, we also have 147 registered quality improvement project. It means people are very interested in PLT and they restrict a lot of quality improvement projects. However, they have to go through the consult. They have to go through the quality consult. So only 36 projects has approved. And then among these projects, they have a number of projects that were implemented by nurse. And then to 2021, because of the pandemic, so we cannot celebrate a lot of we cannot celebrate a lot of activity. However, we still have some quality improvement project. That's 4 improvement project, and 2 of them were implemented by nurse. And this year we have 80 quality improvement projects registered, and 51 of them were approved by quality, but were approved by the quality concern, and then 29 of them were implemented by nurse. And I will share for you some improvement that were implemented in Hoàng Mỹ Cửu Long Hospital. So the first one is the improvement that we have already shared last year. It means we apply a very simple and easy to distinguish for the patient condition with the wristband. You can see before the patient have to wear a lot of wristband. For example, the color, the yellow color is mean the patient are high risk of falling, and the red color is mean the patient have allergies to something. And then we improve, we train that now the patient only needs to wear only one wristband with a different kind of sticker. And then last year, we also designed a very safe and low cost cabin to help us to transport the COVID-19 patient to from emergency department to other department. And because in hospital, we have a lot of different kind of transfusion solution. So in order to help the staff easy to alert and can be more pay attention to the solution. So we use a different kind of color to help them to know that it means with this kind of color, this is a very high risk transfusion. They need to double check before they insert for the patient. And then with nowadays we have a lot of medical record, because we still have paper medical record. So we have to disinfect the medical record. So we have the sticker with different kind of color to label to help us know that whether the medical record is infected or not. And also we also have some kind of room that we need to use the ultraviolet light to disinfect it. So we have a warning label to help the staff know that the room were disinfected and they cannot enter the room. And also with this kind of improvement, because in the medical record, we still have the paper medical record, and sometimes they still have the error that the pupil writing the wrong side of the patient. For example, the patient will have the it will have the disease in the right side, but they write in the medical record will be the left side. So we have the sticker on the top of the medical record to warning the doctor and nurse to know the correct side of the patient. So in order to make them more warning and more alert about the side of the patient side. And so that brings me to the conclusion of how we can maintain the BLT in Hoàng Mỹ Cửu Long Hospital. That means we believe that the role of the leadership were very important. And we're lucky to have a very strong support from our CEO to maintain BLT. And also, as Dr. Kawakami has shared in his presentation, that we also use a different channel to introduce BLT for our staff. We use a workflow, look like our Facebook, and we have a mini game. And in our quality newsletter, we also introduce BLT. And also, we also apply PLT training to train protocol, to train for our staff. So they believe that by PLT, the training will be more interesting and more interactive. And last but not least, we believe that staff, especially nurses in Hoàng Mỹ Cửu Long, are play a very important role in our quality improvement. And also because they believe that PLT is a great approach for them to improve quality. So I think that's all for my presentation. Thank you so much. So you can see that at BAOT.
Thank you very much, Dr. Phan Ngoc. We are having a questions about the keynote speech for Dr. Kawakami. So we'd like to so I would like Dr. Kawakami to answer the question of the participants.
Okay, thank you very much. Yes, some participants asked the question to us, if we have any failure experience, how we can make participatory approach success, and then how to prepare. Honestly, I have the training itself. We don't have real failure experiences because we try to carefully prepare for the success, meaning we are working together with projects and networks. Then we can communicate to the target workers, employers, and their workplaces in advance. Then we can understand each other. They really need this kind of participatory training. So we avoid the kind of mismatch or mis-expectation. Then we prepare the contents very practical, as you see, the very interesting practical training materials. So that I think usually we can make it, I don't say always 100% successful, but we never experience very bad experience, failure experience, and unexpected, kind of reaction, etc. So then another question, how we evaluate? Yes, after each training, we can distribute a simple questionnaire for immediate evaluation if participants are happy about the contents and they understand. Yes, we can receive, usually very good feedback. But sometimes they say they need more good practice pictures, or they need more longer time or shorter time, etc. But in overall, of course, we evaluate ourselves to try to improve the content condition. The most important point is the long-term evaluation. That is, as Dr. Kai said, how much those previous participants can really implement training by themselves and implement improvements. That is a kind of long-term evaluation. We can keep up our networks with trained workers, employers. Then we can continue our relationships, then learn from each other. Then we can make it sustainable. So this aspect, honestly, it's not always easy to keep good relationship for 5 years, 10 years, I don't know. But at least 1 or 2 years or 3 years, we can sustain our networks, through our networks. So always we want to say we prepare ourselves very carefully to meet the needs of the clients. And we can always working together with networks, not alone, not you. And then always we can focus on good practice approaches, workers, employers approaches, not the specialist approach, not compliance approaches. So that is also another very important element for the success. So I hope I can answer to your questions. Okay, over.
Thank you so much, Doctor.
All right, thank you, Dr. Kawakami. So next one, we would like to invite the second achievement report from Dr. Myung Yu from Korean Industrial Health Association, Daegu, Gongbu Regional Headquarters, to present your achievement report about activities to prevent industrial accidents by establishing OSHMS.
Hello, I'm Nguyen Yu, and I work at the Gyeongbu International Industrial Health Center of the Korea Industrial Health Association. What will be announced today is the accident industry prevention activities by establishing OSHMS. Government guide for establishing OSHMS. The Korean government enacted the act and the punishment of serious accidents and has been in effect since January 27, 2022.